Hand hygiene, a simple way to protect health. Whether you work in a senior's residence, a hospital, or other healthcare setting, hand hygiene is the single most important measure you can take to protect your residents and your own health. Infectious diseases can spread easily between residents and staff when hand hygiene isn't performed properly or often enough. Outbreaks of infectious diseases are stressful for everyone and can be very serious or even fatal for some residents. Outbreaks can also tremendously increase the workload for employees. Why hand hygiene is so important? In our day-to-day activities, we all touch objects that many other people also touch, such as doorknobs and handrails. Germs on our hands are easily spread this way, and some can cause serious illnesses, including MRSA, influenza, and gastrointestinal infections. The good news is proper hand hygiene can help stop the spread of germs and disease. In this program, we'll look at simple hand washing and hand sanitizing techniques that can save lives and reduce stress for residents and staff in healthcare settings. We'll also look at when hand hygiene should be performed in order for it to be most effective. Please note that during a confirmed outbreak, the preferred method of hand hygiene may change. There are two methods that you can use to clean your hands and reduce the spread of germs. The first is hand washing with soap and water. Hand washing is recommended when there's any dirt or other visible material on the hands. Washing your hands isn't complicated, but it has to be done correctly to be effective. Follow these simple steps to wash your hands with soap and water. First, wet your hands with warm running water. Avoid hot water, which can dry your skin. Next, apply liquid or foam soap. Bar soap should never be used since it can harbor germs. Rub the soap vigorously into a lather over all surfaces of your hands. Continue washing for at least 15 seconds in order to remove germs. Pay special attention to your fingertips, the area under your nails, between your fingers, on the back of your hands, and the base of your thumbs. These areas are commonly missed. After 15 seconds of cleaning, rinse your hands well under warm running water. Rinsing off all soap will help remove germs and help prevent skin irritation. Dry your hands well with a paper towel. Pat them dry instead of rubbing them to help prevent chapping. Finally, turn off the water taps using the paper towel to avoid recontaminating your hands. Then, throw it in the garbage. The second method is using a hand sanitizer, also known as an alcohol-based hand rub, or ABHR. Hand sanitizer is an excellent product for disinfecting hands. However, it should only be used when there's no visible dirt or other material on your hands. If your hands are soiled, wash them with soap and water using the techniques described earlier. Hand sanitizers have a number of benefits. They're easy to use, don't require water, and are faster and more effective at killing germs than traditional hand washing. They're also less likely to cause irritated or chapped hands because they have skin conditioners added to them. In healthcare settings, hand sanitizers should contain at least 70% alcohol to successfully kill germs. Follow these simple steps to disinfect your hands with hand sanitizer. Squirt a loonie-sized amount of the hand sanitizer onto one palm. Spread the sanitizer on your fingertips, the area under your nails, on the back of your hands, on the base of your thumbs, between your fingers, and the entire surface of each hand. Continue rubbing your hands until the hand sanitizer has dried. This should take at least 15 to 20 seconds if the proper amount of sanitizer is used. Hands must be fully dry before coming into contact with people or objects in order for the sanitizer to be effective. Do not use hand sanitizers with water. Whichever hand hygiene method is used, skin should be healthy and without cracks, cuts, or scratches. Nails should be kept clean and short. Avoid long nails, artificial nails, nail enhancements, and jewelry, as they're difficult to clean, can hide germs, and can pierce gloves. When to perform hand hygiene? To reduce the spread of germs, hand hygiene should be performed frequently throughout the day, especially before and after contact with a client, as well as before and after contact with items in the client's environment. Before performing aseptic procedures, such as changing a catheter or dressing a wound. Before preparing, handling, serving, or eating food. Before putting on and after taking off gloves. After any possible contact with a resident's bodily fluids, or after any personal bodily functions, such as when you assist with nose blowing or use the washroom. Remember, if your hands are visibly soiled after coming into contact with blood or other bodily fluids, you must wash them with soap and running water. Performing proper hand hygiene has many important benefits. Washing and disinfecting your hands regularly reduces the spread of germs and lessens the chances of an outbreak occurring. This can save you the increased workload and stress an outbreak can cause. But most important of all, good hand hygiene protects everyone's health.